The breastfeeding pattern is typically 2 to 3 hourly. Some babies may cluster feed, which means they feed repeatedly an hour or so, but then they sleep for longer intervals. If a baby is persistently cranky and keeps feeding, it might indicate that the mother needs lactation support. This is especially if the weight gain is not good as well. A breastfeeding baby typically feeds 8 to 12 hours, 8 to 12 times a day. Formula feeding is more controlled, and 3 to 4 hourly feeds, 6 to 8 feeds in 24 hours. And the volume you expect is about 140 to 200 ml per kilo per day. It's again important to point out to the parents that the formula tins, they recommend limits which are on the higher side. So reaching a volume of 200 to 220 ml by 6 months of age is quite fast for most of the smallish babies we get in South Asian culture. Most of these babies, you can expect to increase 30 ml per feed. You can start with 60 to 90 ml for a full-term baby of around 3 kilos, and then you increase it as the baby tolerates. Go by the growth chart as well. Avoid overfeeding and avoid following the instruction on the tin just for the sake of following the instructions. It's better to go by the growth assessment and the hunger of the baby. So roughly 30 ml every month or every 6 weeks is a reasonable pattern. But if the baby keeps refusing the higher volume, don't push the baby to take more. This may be an indication that the baby has a lower growth potential and we shouldn't push more than what is needed. Pushing more may lead to reflux and other problems. As the baby gets older, the feeding frequency is reduced as we progress with complementary feeding. Around 1 year, breastfeed as often as the baby needs. If the baby is formula feeding, we don't need more than 480 to 600 ml per day. And many babies may do with just 2 formula feeds a day in addition